But you had built up to eating normal food, is that right?
Oh, crikey, yeah. I've been able to teach myself to eat all sorts of food just lately. You know, it took a long time.
Yeah. How long would you say after the discharge home?
I had a pegging for 18 months.
Yes, a peg is a
feeding
tube.
If you like, yeah. And
direct into the stomach, yeah.
Yeah, I had to put in Fortisam?
Fortisam,
yes, yeah.
The build-up drinks.
That's right, yeah. So eventually I was able to suck through a straw. So I was doing the Fortisam through a straw, but my drugs I couldn't swallow, you see. And we had to crush the drugs up, mix them up with a liquid and pump them through. So it was very inconvenient for 18 months.
Yeah.
But Julie, my wife, she's a great cook. It's a business. She's a catering manager, like, you know, and she was concocting all sorts of food for me that I could eat. And gradually, I've worked myself now that I could swallow properly. I could chew food again.
So what was it that you were, when that difficult period was there, when you were just transitioning back to solid food again, what kind of foods could you manage? Because the viewers would like to hear a tip there about what they can manage if they've got a similar situation.
Well, providing you can swallow, and it depends, I suppose, on what type of teeth you've got left. I mean, I was very fortunate. I don't know why, but I seem to get very special treatment when I went to from the orthodontics department up at the Glenfield Hospital.
I see.
Yeah, Addie's her name, and she was a wonderful woman, and the denture they first made wasn't fitting right. It was causing me some pain, and they were very patient with me. I'm obviously not the first patient they've had, but it seems that they were spending a lot of time just making sure that everything was fitting right. And
so come back to the food issue for us. What were you saying?
Oh, the food?
What were you able to manage when it was still slightly difficult?
Well, when it was still slightly difficult was what we used to do was we used to mince everything up. So I could have all the types of food that I normally would have, but it would all be minced up. And I would use a spoon and sort of swill it around my mouth, as it were, and try to swallow. Now, nobody told me about that either, that I wouldn't be able to swallow immediately. It's something I had to learn myself. And that was hard work, but eventually I got round that. And once I made these teeth, it took me some time before I could sort of chew correctly.
Yes.
So it was a very slow process going from Fortisam up into soup through a straw, and then I suppose eating like a baby, you know, baby food, and sort of sucking it and swallowing it that way. It was difficult, but it was a learning curve which I think I could have had more help for with getting over that problem.
That's fair enough.